Our top story today. COVID-19 reinfections may be rare, but they cannot be ruled out. The World Health Organization chief scientist, Dr. Soumya Swaminathan, said that the World Health Organization had received new reports of reinfection from coronavirus variants, including initial reports from South Africa suggesting that people who have had prior infection could get reinfected again from the coronavirus variants. Now, while some studies say that it is a rare phenomena, people with antibodies could still be reinfected with the new variant. What does this really mean for us? This essentially suggests that immunity after infection may not be able to save you from being infected again. This has prompted many now to ask if vaccines alone can save us. Now, this question of reinfection has raised several doubts and concerns among several of you. We'll have a panel of experts to answer some of those questions. But first, let's listen in to what the chief scientist had to say.
We're now getting reports of people getting reinfected with a new variant of the virus. And there have been some initial reports from South Africa suggesting that that people who've had prior infection could get infected again.
So what does this possibility of reinfection mean for us? Well, we have a panel of experts joining us from London today. Dr. Rajay Narayan, Director of the Global Health Alliance from the UK. We also have Dr. Manoj Goyal, Director Pulmonology, Fortis Memorial Research Institute. Thank you both doctors very much for being with us on the broadcast. Dr. Narayan, I want to begin by asking you what this essentially means. The possibility of reinfections essentially means that even for those who've been infected with COVID-19, who have antibodies, can contract a variant strain of the coronavirus.
Yes, as you saw in the news that the chief scientist is warning us, because there was a study done at the University of Witwatersrand in Johannesburg, and they found that out of 2,000 people that they had in the study, almost about 5 to 10% of the people were getting reinfection in spite of the fact that they were infected with COVID in the last 6 months or the last 1 year. So again, the new variant, which is the B1351, is again causing lots of Africa because of this variant. And what this...
Right, Dr. Narayan, I think we have a trouble connecting with you. We'll try and re-establish that line. Dr. Goyal, if I can come to you, there are two types of immunity that we know that kicks in after you've been infected with COVID-19. One, of course, is antibodies that develop. But doctors and experts also say that if you don't have antibodies, there's still T-cell immunity that protects you for a longer period of time. Do these new revelations of reinfection now negate all of that?
Yeah, actually, the phenomenon of reinfection is under investigation, as a matter of fact. And once the immune system is activated against a virus, usually this immunity lasts for about 8 months to 1 year, and the studies have shown those who have got infected with the COVID virus have got their immune system active against this disease for about 8 months at least. But after that, that immunity passport, global, the WHO had talked about it about a year ago. They said the infection does not give you immune passport to reinfection. So possibility of reinfection, although it may not be major issue, may not be in a significant number, but it doesn't give you immunity passport against the reinfection. So that's why we have to be very, very careful, even if somebody has got infected with COVID infection.
Right. So irrespective of whether you've had COVID or not, you need to be extremely careful. Dr. Narayan, are we concerned about a particular strain, in this case a South African strain, for reinfection, or is reinfection possible through any strain, mutant strain of the coronavirus?
As we know that the virus has got a tendency to mutate, and they keep mutating at a very frequent interval. Some of these are not that bad. Some of them are quite bad in the sense that, as I said earlier, that they can cause something like immune escape in the medical terms. So that can escape your immunity and still infect you in spite of the fact that you had infection or you had COVID in the past. And that is what we are finding in South Africa, because the new variant in South Africa, almost 5 to 10% of the people who have got this new variant had COVID in the last year as well, in the first wave. So this is very scary, because again, you think that once you get COVID, you are sorted for next 1 year, next 9 months, you may not get it again. But now we are seeing that patients are getting reinfected. And in fact, in the UK also, we have seen almost about 1 to 2% cases where people have got reinfected of COVID from the usual strain. So again, reinfection is very much possible, and hence it is very, very important that apart from the fact that we keep making social distancing, make sure that we do all the right things. Vaccination is the only thing that is going to prevent us.
You know, I will come to vaccination and vaccines specifically, which ones protect us more and you know, which ones less. But the other big question then that a lot of our viewers have asked, Dr. Goel, if you'd like to take that on, how long then can we say that immunity lasts if you have been infected with coronavirus? Previously, it was believed that you will be immune for a longish period of time, some, you know, stretching it to even 9 months. Would you now say that that's not the case?
I think that case still is there. The immune system may remain active against the further infection for about 8 months or so. But yes, it again, as I said, does not give immune passport. It could be immune escape. There could be new variant which can, you know, breach this immune system and cause the infection. Even the previous strain can, you know, breach this barrier and cause the infection. So reinfection is always a possibility. It can never be negated.
Right.
Even though we got infected, we have to maintain the precautionary measures.
So no immunity passport. I like how you phrase that. But Dr. Narayan, the other question then is, you know, is COVID-19 reinfection worse? Will your second bout, God forbid, if you are to contract it again, will it be worse?
There's no data to suggest that if you get COVID second time, it's going to be bad. But yes, recurrent strike to your immune system, recurrent infection obviously makes you weaker and more prone to more complications that can happen from the COVID.
Okay, so is vaccine then the only answer? Dr. Narayan, you already addressed that. But, you know, we are also seeing data, for instance, the AstraZeneca vaccine, you know, being more effective against one strain, less effective against another. So is vaccine the only short answer that we have?
At the moment, we don't have any drug that can prevent us from COVID. At the moment, we don't have any other injection or medicine that can prevent us from COVID. Vaccine is the only answer. When it comes to vaccinations with the new variant, again, going back to South Africa, they have found that the new variant, the AstraZeneca, was not being so effective, but the Novavax vaccine has got almost 50 to 55% effectiveness against the new vaccine. But the good news is that AstraZeneca team and the Oxford team in England are working very hard on this new strain. And hopefully we'll have a better vaccine coming soon, or possibly another booster coming very soon, which will fight against this new strain.
Dr. Goel, you know, that brings us to the other question as far as India is concerned. We so far haven't really had, you know, enough evidence to show that there are several mutant strains. But one is seeing, you know, a surge in cases. You know, take Maharashtra as a case in point, or Mumbai specifically. You know, do you believe that more research needs to be done in India in order to be able to better identify mutant strains of the virus?
I think so. That's a very important point, and we really have to look into it and keep finding why the recurrence is coming back. Of course, there could be one theory that, you know, this infection comes in waves. So it may be first wave over, the second wave is coming back. So that could be one theory, but definitely why this wave is coming back? What is the strain which is causing it? Is the previous strain which is causing it, or is the new variant which has come up which is causing it? Or we have got the infection from outside, like from South African variant which has come up and is starting the reinfection in our community. So this is a very important investigational case that we have to work on.
Right. Dr. Narayan, you know, just very quick last question while we're on this. We know that, you know, there are different vaccine technologies. Do we have any evidence to suggest that, you know, an mRNA vaccine perhaps is more or maybe less effective against a mutant strain? Does the vaccine technology really determine efficacy in a certain sense against virus mutations?
There's no data or head-to-head comparison to say that this vaccine is better than the other vaccine. But yes, mRNA vaccines are going to be more effective in the sense that mRNA vaccines are easier to make changes to fight the new mutation. So again, that is what Oxford vaccine people are working now to see how well they can encounter and fight against the new variant from the South African.
All right. Well, Dr. Goel, thanks so much for joining us. Dr. Narayan, I urge you to stay on, because since we're talking about variants, you know, especially when we look at the UK. Now, in order to prevent new variants from entering the country, the UK has imposed tougher new travel rules for anyone who is returning to England from one of the 33 high-risk red list countries. Now, 33 countries in the world have been red listed. These countries have been touted as high risk, and if you are entering the UK from any of these 33 countries, there are new quarantine rules that will apply. Now, what are these rules? Well, compulsory hotel quarantine for those arriving from these countries, and India is not on that list of 33, not as of now at least. Those arriving will have to pre-book and pay £1,750 to spend 10 days quarantining at a government-sanctioned hotel. There's a 10-year jail term or a fine of up to £10,000 if you don't comply with these rules. And those who have not visited a red list country, which is India for instance, must still quarantine for 10 days at home and complete 2 mandatory COVID-19 tests on the 2nd and the 8th day after arriving. So these are some of the new rules that have been put in place. Dr. Narayan continues to be with us. Dr. Narayan, I mean, you know, the UK has been particularly badly hit when it comes to the mutant strains of the coronavirus. What do you make of these new rules?
These new rules are very, very important because, again, there have been discussions that in the past we were not able to implement our rules strictly. We were not able to seal our borders strictly. And hence, there has been a lot of criticism the way the first wave was handled. And that is why the government has made it extremely difficult now for people coming from these 33 red countries to come to UK, because we can't afford to have more lockdown, because we are now in the second wave of the virus. We have been in the house for almost a year now. We are still in the complete lockdown. In the next few days, the government is going to make a decision about how the lockdown is going to be eased. So we are in a very difficult situation in the UK. The number of deaths have definitely come down. It's now around 200 to 300 in the last couple of days. We are still getting 10 to 15,000 positive cases on a daily basis. So again, on top of this, if we get new variant, that will be extremely challenging for the government to manage.
Do you think that other countries perhaps need to learn from the UK example? Because, I mean, one of the reasons, obviously, why the rules are so stringent in the UK is because of the experience that the UK has had with the mutant strain in the last couple of months. Do you believe that this is a policy perhaps that that other countries need to consider as well at this point?
Absolutely, because, this is what we are now learning in the second wave, that we should have done possibly things more in a better structured way, more planned way, because the way we are getting affected, the number of cases that are rising, the number of young people getting infected, the number of complications going up. So this is a learning curve for all of us. And in fact, this is something that the entire world should see, that we were in a phase in November, December where the virus was almost disappearing. And then suddenly there's a big surge from January where thousands of people were dying till last week. So this is very, very important, that we need to take it very seriously. We cannot be sure till the virus is completely gone. And the only way forward is to make sure that we get the vaccination to maximum number of people at the earliest possible opportunity.
Right. It's a bit paradoxical to be having this conversation, and especially I'm sure for our viewers in India at the moment, because here we are seeing, the opposite. We are seeing COVID-19 rules and regulations being relaxed. We are seeing schools reopening, swimming pools reopening, cinema halls reopening. What do you make of this complete paradox as far as COVID-19 rules and regulations are concerned?
I mean, I can only say that India is very lucky, and we know that India's population is very young. More than 65% of India's population is less than 35 years of age, which is very good for India. But again, there have been lots of hypotheses in the past that previous infections or TB exposures prevent people from COVID infection in India. But again, these are all hypotheses, and we'll have to see some more robust data before we come to a conclusion as to why India has been so good as far as COVID is concerned. But yes, it is very important that you have to obviously open up the schools and go back to your normal life. You have to do it in a very small phased way, because again, you cannot afford to have another wave of infection, because especially if you get one of these mutant viruses, then things are going to be very bad.
There was evidence of the mutant strain of the coronavirus coming here in India as well, but it hasn't really led to the surge like one saw in the UK. Is there any particular reason?
I mean, I can only tell you that the entire world is looking at India at the moment as to why India has done so well with COVID. Obviously, the government has made taken lots of good steps, which has helped. Okay. But there are lots of other explanations, lots of other hypotheses that we need to work on as to why India has done so well as far as the COVID is concerned. And this is a question for the research people to look into in the coming weeks and months. But this is something very, very interesting, because when COVID started in India, we were very scared, because India is second most populous country in the world. And we were all very scared that things may go bad. But we have escaped as far as the first wave is concerned. But we have to be very, very careful, because any other new can cause problems.
Well, it could very well be a stroke of luck or some, deeper scientific reason. But irrespective, I think the doctor's advice is that COVID-appropriate behavior has to be maintained, whether you've been infected with COVID-19 or not, and whether you've been given the vaccine or not. Thank you so much, Dr. Narayan, for joining us on the broadcast. We're going to slip into a very short break. But on the other side, we'll talk about the Maharashtra numbers. We'll also talk about why there has been such a low turnout for the second dose of the COVID-19 vaccine. Stay tuned. Welcome back. The COVID-19 cases are surging in Maharashtra once again. There have been over 3,300 cases in the last 24 hours. This number was over 4,000 the day before. Now, this is worrying for the state of Maharashtra, but what's even more worrying is that only 71 out of 1,926 people showed up for the second dose of the COVID-19 vaccine yesterday. I repeat these numbers. 1 month ago, there were 1,926 people who got the first shot of the COVID-19 vaccine. They were scheduled to get the second shot yesterday, but only 71 people showed up. What does this mean, and what happens if there is a delay? We have Dr. Gautam Bhansali, the Chief Coordinator of Private Hospitals in Mumbai, also a consultant physician with the Bombay Hospital, joining us. Thanks so much. Dr. Bhansali, what do you make of these numbers? Only 71 of 1,926 people show up for the second dose.
Yes, that is true that yesterday there was only 71 people was vaccinated second dose. And there are three major reasons behind this. One was there was a big technical glitch on this COVID app. So many people who received COVID vaccine on the 16th of January, day one, their name was not reflected on this COVID app. So that was the major reason. So many healthcare worker was returned back. They were sent back because their name was not reflected on this at this app. So this was the basic technical glitch was there that was causing the problem. Their name was not reflected. That's why they were refused. In fact, the first person who took this vaccine, Dr. Mridula Patil, her name was also not reflected in this app. So that was the major issue. Second thing was that there was a lot of misinformation in the WhatsApp University and Google that regarding the timing of this second dose. Some says that you should take after 28 days. Some messages were saying that you take after 8 weeks. Some messages were saying you take after 12 weeks. Right. So that was also misinformation regarding this timing of the vaccination. And third issue was that 2 days back only in Mumbai, they allow private hospital to give vaccine to their own staff. So many doctors were reluctant to go to other center. They were thinking that in next 2 or 3 days, the vaccine will start in their own hospital, all hospital setup. So why to go to other centers? So that was also one reason. All the private hospital, around 25 to 30 private hospitals, they are allowed to give vaccine to their own employee. So that's why number was less.
The question,
but the major issue was
the question that I have, and I have two questions. One is that do you fathom that this would have led to a big wastage of vaccines?
This is not wastage of vaccine. I feel if you take vaccine after 2 or 3 days, that is not going to harm or that is not going to wastage of the vaccine, because they all have the storage capacity and they can maintain the temperature and that their efficacy. So wastage is not there.
Okay. So wastage is not there. But what about the delay? If there is a delay in taking the vaccine dose, what's the time? What's the time frame, so to speak? Because 1 month is what India is following. But how much can you delay it?
So we can delay as per the new guideline, as per new data. They are showing that if you should take second dose from 4 weeks to 12 weeks. So anytime between 4 weeks to 12 weeks, again, because of some misinformation that you should take only after 8 weeks, that because of that turnover was also low. But that is not going to harm, or that is not going to wastage the vaccine, or that is not going to wastage the first dose also. It's not like that at all. But I feel sooner is better. If we finish second dose as soon as possible, then we can give to the other people.
Which brings me to my final question. Doctor, if you could just highlight for our viewers, how important is it to complete the 2-dose regimen?
I feel to complete the for the efficacy of this vaccine, you should take second dose, because I have done myself that antibody after taking first dose, after 4th week of the first dose, I have checked my antibody. It was 32%. If I take second dose, I have taken second dose yesterday only, day one, and I'm sure that my antibody will go up to around 100 or 150.
Right.
So to increase your antibody level, you have to complete your second dose. Second dose is very, very, very important for the efficacy, for the potency of this vaccine. But you have to decide what you want. You want vaccine or you want that virus.
All right. So you have to choose between the vaccine and the virus, and I think that's a no-brainer. Thanks so much, Dr. Bansali, for joining us with your point of view on that very important story. We'll keep a close watch on what's happening in Maharashtra.